Progressive Health Initiative of Liberia Field Incorporated, we believe that good health is everyone's responsibility. When you take care of your body, you protect your future.
Healthy people build strong families, and strong families build strong communities.
You are tuned to Field Health Hour, your trusted public health program.
On Radio Kepamos 92.1 FM. We share facts, not fear.
We educate, not judge.
We empower you to make healthy choices.
Wash your hands regularly.
Sleep on a mosquito net.
Eat healthy food.
Seek care early when you feel ill.
Health is life. This message is brought to you by Progressive Health Initiative of Liberia Field Incorporated
in collaboration with
Maryland County Health Team, Partners in Health, and Field, and the Ministry of Health and Social Welfare, Republic of Liberia.
Progressive Health Initiative of Liberia, Field for short. And today's Wednesday, this program comes your way. This program comes your way every Wednesday at about this time. But due to certain issue, we're able to start here exact time. So no time to waste. We move to Studio 2, where we have our regular presenter along with his colleague, the president. So welcome, guys. Welcome to your program.
Thank you once again. My name is Isaac M. Blair Jr., volunteers and founder of Progressive Health Initiative of Liberia Field Incorporated.
Okay, I'm James Tumamba Allison, a regular presenter of Global.
All right, so thank you and once again welcome. Like our host rightly said, we want to say sorry. We would like to apologize. We did not start at 7 o'clock exact due to other technical issues. However, we will continue with our talk show. So we say good day, good evening to our listeners on Radio Kepamos. This is Field 1 Hour Health Program, your trusted voice for health promotion and disease prevention in our community. So today we will be talking about sanitation, hygiene, and disease prevention. And these three things we just named, sanitation, hygiene, and disease prevention, may sound big, but they are actually simple daily actions that can either keep us healthy or make us sick. So, and you know, Terrence and my other guy here, every presentation we bring different topics and we discuss different topics. And then tonight discussion we have a theme. So we ask our listener to keep close and glued to their radio. If you have your pen and paper, it will be very interesting. You can jot down some key points. When it is time for calling to give your input, to give your suggestion, to add on to our discussion, then you can also help us to make this program unique. So tonight we have a theme. And the theme for this program, for tonight's presentation is Clean Environment, Healthy Life.
Clean environment,
Healthy life. That's the theme for tonight. So to go straight into discussion, Terrence, we know that many diseases we suffer, we will say from in Liberia. We want to be specific with our country. Most of the diseases we suffer with in this country are not caused by witchcraft. Let people directly say. They are not also caused by curse. And they are not also caused by poverty alone, those diseases. But they are caused by, some are caused by dirty surrounding. When the surrounding is dirty, you encounter disease. Poor hygiene, it also gives us some of those sicknesses. And then lack of sanitation. So today we'll be discussing sanitation, hygiene, and prevention. So if you listen well, it will be very good tonight. So by the end of tonight's discussion, there are a few things we like for our listener to know, to understand. So at the end of this discussion, we will get to understand what sanitation what sanitation and hygiene really mean. That the first thing we would like for our listener to know, and they will get to know at the end of this discussion. Then how poor sanitation causes disease. We'll also look at that, and we'll get to understand how poor sanitation affects us. And lastly, we'll also get to understand simple things we need to do to protect ourselves and our family.
Okay.
So during the previous presentation we were here, we talked about hygiene practices, and tonight we have come to add on to that.
Okay.
So first of all, let's know what is sanitation.
Sanitation.
Yeah.
Very much.
So sanitation, in a very simple meaning and understanding, it means how we manage waste
Okay.
and keep our environment clean,
Yeah.
so it does not make us sick. When you keep your environment, how we manage waste and keep our environment clean, for us to not fall sick, it's all about sanitation. That word is big, but it has simple meaning. And then sanitation have a lot of things in it. So we say sanitation, it has something that we need. It has inclusion. We have proper use of toilets and latrines. It's sanitation. When a latrine and the toilets are used properly, it's sanitation. Safe disposals of garbage is also sanitation. Clean surroundings. When we talk about surroundings, you will hear surroundings whole night. Is home, markets, and streets
Yes.
are all surroundings. When we keep them clean,
The entire city.
the entire city, that's sanitation. Then we have proper drainage of dirty waters. The drainage we have in our communities, in our homes, when we clean them properly to take away the dirty water that's set within them, we are carrying on sanitation. That's the act of sanitation. And then we have some real life examples. That's why we say our listener should get glued to their monitor, to get some pens and paper to get some points down for further discussions. Because for real life example, if you don't practice sanitation like what we just listed, open defecation in buches, we know people openly defecate in buches.
Exactly.
It is real life example.
Yeah, it's something
And
that
then-
someone in your surrounding.
Thank you. And open defecation also take place at beaches. Apart from beaches, we go to beaches where we use for recreational activities. People use it to defecate. It's also a real life example. Or open defecation behind houses. It's another real life example of sanitation. It is against sanitation. And then we have garbage dumped near homes or in the creeks. Like in a village or in the interior, sometimes people say that be wasting the dirt in the water, in the river there.
Yeah.
It's common in Monrovia.
It's common in Monrovia, even not even in the interior, but in the capital city. It's common. We take it to be common, but it is affecting us.
Exactly.
It is against sanitation.
Mosquito and other things travel through that.
Through that mosquito breathe through dirty waters that set in drainages. So another real life example is black drainage filled with dirty waters, like what you just said about mosquito. And then we have public toilets not cleaned regularly. It's another real life example that is against sanitation. So these things may look common and normal to us. We say, but we've been wasting dirt in the water. The dirty water been here for a rack of ages, but they are dangerous.
Yeah, it's very bad.
They are very dangerous. So sanitation has very good impact on society, but those things that we just listed, they are serving as barriers to sanitation among us, and we take them common, but we'll discuss them in detail. So why poor sanitation is dangerous? Let's look at that. Like those things we listed, why poor sanitation is dangerous? There are few points. There are many points that we need to list, but we're dealing with time, so we just check down few.
Okay.
There are few points we'll be giving our listener. When waste is not properly managed, there are few things we encounter. Flies carry germs from feces to our food. We know what fly can do in our environment.
We know.
Go directly behind the house where open defecation is, or to the dump site, sit on it, we fly from there straight coming on the food.
Yeah.
So it's another effect of poor sanitation that what makes them dangerous. Rain washes dikes and feces into wells and ponds. There are other wells in the community, they are not
It's not really to a suitable area.
to a suitable area. So when the rain falls, The water,
Yeah.
everything goes directly into the well. And from I seen where we draw water to cook. Sometimes we even drink.
Yeah, exactly.
And the other pump that are not even in good condition, rainwater also enter into them. And then it is dangerous, and it is also there are causes of poor sanitation.
Okay.
Children play around dirty areas and put hands in their mouth. You can't stop child from putting hands in their mouth. Something very common.
I don't know what can really be done in stopping that one.
Okay.
It's really common.
Okay.
When children play around the end of the day without wash their hands, they will play food.
We will provide remedies. What we need to do as parents,
Yeah.
as community members,
Yeah.
to curtail. We can't stop it 100%, but we can work on it.
To minimize.
So children who play in dirty places and then put hands in their mouth is another dangerous aspect of poor sanitation. So these are few things we discuss when the sanitation is managed poorly. And then we have diseases that are linked to poor sanitation. If you do this, you will get this. So we need few diseases, and those diseases that we are about to name, we dealt with them in the second edition, and today is the third edition of Field Health Hour.
Okay.
So we talk about cholera that you get from contaminated water. It is also a disease that is linked to poor sanitation. And then we have typhoid fever.
Yeah.
Dirty water, contaminated food, you get typhoid fever. It is also linked to poor sanitation. Diarrhea, another contaminated water disease. We get it from poor sanitation. Dysentery, contaminated water, contaminated food. It is also linked to poor sanitation. And we have one we call worms infestation. This worm infestation is mostly found in kids.
In kids.
Yeah, that play in all type of places, the dirty places we talk about.
Yeah.
And they are all given to human or entering human body through poor sanitation. So for example, when cholera breaks out, for example,
Isn't that this cholera can really lead to diarrhea as well?
cholera, yes,
Oh,
yes, it can lead to diarrhea.
okay.
And then, like for the outbreak of cholera, it is now to say it coming from the air or breeze breathing.
Yeah.
This it is coming directly from poor sanitation. How you manage your food, how you cook your food properly, your home, how you take care of them. That's how you don't fly through air. It comes from dirty water, dirty toilets, dirty hands. That's how cholera breaks out amongst us in our environment. So this is how we like to conclude on sanitation, and it takes us to hygiene, because we are discussing sanitation and hygiene, and then with prevention. So what is hygiene? For hygiene, we've been hearing hygiene, and normally people say personal hygiene. Yeah, that's the common one. So tonight we will be giving you the types of hygiene. There are other types of hygiene, but that we might not be in the know.
Yeah.
People are not been telling you everything. Personal hygiene, we also look at that. So hygiene is how we keep our body, our hands, our food, our clothes clean to prevent germs from entering our body.
Yeah, include our environment.
Including our environment as well. So hygiene and sanitation work together.
Okay.
So that's why we say sanitation, hygiene, and prevention. So there are types of hygiene. Hygiene comprises of 7 personal practices. 7 personal practices.
Okay.
We have hand hygiene, we have oral hygiene, we have body hygiene, we have nails hygiene, ear and nose hygiene, hair, the hair that is on our head.
Yeah.
We have the hygiene, and we have clothing, the clothes we wear.
Okay.
We have hygiene. These are the 7 practices of hygiene. But those 7 practices are all categorized into 4 to 5 plus. 4 to 5 plus border areas. So there are 7 practices, but when you come to the types of hygiene, they are 4 to 5. And the one that make them 5, we are going to explain it tonight.
Okay.
So the first hygiene that we want to look at is personal hygiene, which we've been hearing about every blessing day.
Even in kindergarten,
Yes.
elementary school.
Thank you.
Yeah, these are things we don't want to hear about.
Thank you. Personal hygiene. For personal hygiene, we have bathing.
Yes.
Taking bath.
Yeah. Washing hands, brushing your teeth regularly. These are personal hygiene, because you need to take your bath. I'm not going to come to bathe with Terrence. I'm not also coming to your house to brush your teeth for you. So it's a personal hygiene. That why they call it personal. Yourself. Thank you. Yourself. You need to do that. We have food hygiene. Food hygiene is washing your food, covering your food, cleaning your food, or clean cooking. All are embedded into what? Food hygiene. So it is not personal hygiene alone, but we have food hygiene as well. Then we have environmental or home hygiene, where we have cleaning the home and surroundings. I think we just talked about surroundings. Yes. So these are hygienes practices, and then we have medical and occupational hygiene. This one is specific. It is a specific practice in a healthcare system, and this one is done by the health practitioner, like the nurses, the medical doctors. We have the nurse anesthetic, the physician assistant, the midwives. These are people. The laboratory technicians. These are people who carry on medical and occupational hygiene. And then we have the fifth hygiene.
So they tell what the medical and occupational hygiene. The community members or individual have any impact to play on the beside the health practitioners?
They have impact to play, but their impact is like you will be instructed through the medical team or from the hospital background or health center on what to do. Thank you. So a specific practice in healthcare setting to prevent infection. So they will tell you, do this. It is not a personal hygiene where you like brushing teeth, bathing and other things. And then we have other specific types of hygiene, which is the fifth one. These include sleeping hygiene. The sleeping with it has hygiene. Yes.
First time I hear about sleeping hygiene.
Yes, sleeping hygiene. Maintaining a clean and restful environment is sleeping hygiene. Like you want to sleep, your room needs to be clean. To rest, to sleep. When you are sleeping, you are inhaling. You are breathing.
Yes.
So a restful environment, a clean, restful environment is a sleeping hygiene. Okay. Then we have respiratory hygiene. Respiratory hygiene is where we have covering of coughs. The cough we put out. And covering of sneezing, the sneezing we do. You know, sometimes, I don't know whether you guys have noticed that, but some of us sit in the public and just cough. We don't cover. We have handkerchief in our pockets. We leave them there, or we don't even use our own hand to cover our mouth. We just do it randomly. So
I think this is a common means by which coughing other coughs are spreading.
Spreading.
For once you don't put hand to your mouth, the other people around will be affected. These are airborne diseases.
Thank you. It will travel from one person to another. So we have respiratory hygiene. Cover your mouth before you sneeze. Use your own. It could be a cloth. If you don't have any of them, use your hand. Because right after that, you will wash your hand before you eat or you touch food. And then
before you shake hands.
The last but not the least is menstrual hygiene. Our sisters out there who are listening to us, our mothers, they know what we call menstrual hygiene. And then they are glued with the methods of applying menstrual hygiene. Yes, they know, and they know how to do them.
Other people out there, I mean, they are not really aware of those methods. So it will be good to
know. So in the menstrual hygiene is where our mothers, they have our mother sisters, they have their menstrual cycle. So in that case, where they use the pad, the sanitary pad, and other materials to take care of themselves, prepare themselves for that length of time. And it is something normal, it is part of their body. So the hygiene that is attached to that particular menstrual process is all about how to maintain, to take care of themselves in that time. Like you will stay, you are my sister, you are my mother, you have to cook. You have to cook food, you have to prepare drinking water and other things. So before doing that, once you're in that particular season, things you need to do, how proper you need to take care of your menstrual period
Yes.
while you prepare food in the homes.
Exactly.
That's what we call menstrual hygiene. Proper menstrual practices in times
the
of
home,
yeah.
in the community,
Yes.
in the school.
In the school. Thank you. Sometimes you remain among people, anything can happen anytime, but how you will control all these things are called menstrual hygiene in that menstrual cycle. So with all what
If we move further, right?
Yeah.
It's very interesting. So how can boys or men support the females when it comes to menstrual hygiene?
yeah, thank you. I think field progressive health initiative of Liberia, we have this program 2025 menstrual hygiene. World Menstrual Hygiene Day is May 28th every year, where organizations come together to promote menstrual hygiene, provide awarenesses, and break the myth about this thing. So we as male, we are not exempted from this menstrual. We can help, and we are anticipating to also conduct such program this year. It is where we go in. The last year program we have students from Lady of Fatima, Jara Faith, JS Pride, this school, how you call it, John Hillary, and other institutions, people from other places, the PIH, County Health Team. At Tubman University campus, we have close to 50% attending that program. And we spend an entire day there and this program was organized by this organization, Progressive Health. And our sisters, our mothers, we have facilitators like 4-person who carry on PowerPoint presentation and they provide in-depth. We even have an environmentalist who came. There are environmental aspect of menstruation. Mr. Dominic Miller, who is one of the prof at Tubman University, he was one of our facilitators, and he actually taught us the environmental aspect of menstrual hygiene. And we are also contemplating on that because some were not there, so for them to come and benefit from our upcoming program. So we the men, we are not exempted. Like you, if you are knowledgeable of this menstrual stuff, you help your sister, you help your spouse. It could be you help your wife. Sometimes you can even go as a man and buy the pad for a woman. Other people, it sounds big in other guys' ear, but it is something that is advisable. You go there and get the pad for your spouse, for your sister, and then you take it to them. If they don't know what to do, because some of them they are just getting into this, they don't know. They are not really informed. And then but you are afraid, you are shy to maybe touch them or to go around them. You are doing harm to them. Tell them this is it, do this, and this will happen for you, and then they will do it.
So, and I want to add Brother what you just said.